I think we should separate between developed countries versus developing countries. That's a analogy or something, an expression is used for countries like America and Europe versus Africa and Middle East or South America. I'm sure you know that there are many diseases in the Western world that we do not have them, or in developed countries versus developing countries. And that's all, when we examine, it goes back to hygiene hypothesis. The hygiene hypothesis is a new chapter in immunology, is telling us that if a child after birth is exposed to many bacterial antigens in the environment, the immune system is going to be developed in such a way that will not have allergies and asthma. And if those kids, like in America and Europe, they are not exposed to environmental bacteria and antigens and so forth, their immune system is going to be developed in such a way they are going to have more allergy and asthma. And that's a clear-cut evidence that we know that in Africa and South America and Middle East, children have less asthma, less allergy, and but in America and Europe we have more allergy and asthma due to development of the immune system. In America we keep the children more probably clean and we are more hygiene oriented. We do not let the immune system to be developed in such a way that naturally to protect themselves, and therefore they develop allergy and asthma. So back to the vaccines, that is, nothing is going to happen if we postpone 3 to 6 months or a year to do the immunizations. I'm not against the vaccines, but I'm saying that we should postpone it for a few months or a year. Let the immune system to be developed similar to developed countries, where the immune system of the children, because of exposure to bacteria and viruses, it's mature enough to handle vaccines, and therefore we cannot say, okay, the whole world should not be immunized. We never said that. What I'm saying that children in America and Europe are different from children in Africa and Middle East and South America. Therefore, we should let the immune system to be developed to the level that they can handle the viral antigens and therefore can handle the vaccine.